Hello, everyone. It is January 29th, 2020, and I just wanted to do a quick update on the China coronavirus. This is coming from the South China Morning Post, so I figure it's pretty much close to ground zero. China coronavirus. Hong Kong medical experts call for draconian measures in city as research estimates there are already 44,000 cases in Wuhan. Hong Kong University's Faculty of Medicine Dean Gabrielle Leung says research shows self-sustaining human-to-human transmission is already happening in all major mainland cities. He calls for measures to limit people's movement, school closures, work-from-home arrangements, and cancellation of mass gatherings. Hong Kong infectious disease experts are urging the government to take draconian measures against the spread of the deadly new coronavirus from the mainland Chinese city of Wuhan, citing research estimating that 44,000 patients could be infected there, far higher than official figures. And that number, I think, is a bit low. University of Hong Kong academics on Monday estimated that the number of patients in Wuhan had reached 43,590 by Saturday, including those in the incubation stage of the virus, which causes pneumonia. Mainland authorities have put the number of confirmed cases across the country at about 2,800 as of Monday, with the death toll of 82. Hong Kong has 8 confirmed cases of infection. That sounds like a very low number, but it's just Hong Kong. I guess it's not Wuhan also. Lead researcher and dean of Hong Kong University's Faculty of Medicine, Gabrielle Leung, said his team estimated there were 25,630 patients showing symptoms in Wuhan, and that the number would double in 6.2 days, according to the mathematical modeling based on infection figures worldwide as of Saturday. Scary stuff. Man. So here's some of the numbers. Let's take a quick look here. Mainland officials earlier said that unlike several acute respiratory syndrome SARS, the new coronavirus was infectious during the incubation period. So in other words, you can catch it before it even takes over somebody's body. Those infected with the virus might not immediately show any symptoms. So the highest report is, of course, in mainland China, where they originally released it, but they stole it out of Canada. So how many people caught it between Canada and China? And why isn't Canada being called out? Anyways. Excuse me, I had to sneeze. So in Hong Kong, there's only 10, so they're smart enough to actually stop it ahead of time, or at least try. Macau, 7, Taiwan, 8, the rest of Asia, around 43, Europe, 8, North America, 8, South America doesn't show any, which I did have a hard time believing, but Australasia, 5, and then the rest of the world, 4. And I'd just like to say that why aren't they shutting the borders down, at least country to country or state to state or city to city immediately? I mean, why are they even allowing time for even one person to move around and spread it? That makes absolutely no sense. They're trying to plan out logistics and everything while they wait to close things down. Why wouldn't you just halt everything and then plan out logistics? it makes no sense. They're just allowing this virus to spread all over the place. They could have stopped it in its tracks if they would have just shut everything down right away. In America, I haven't heard a single thing announced about it. No warnings, no advice on how to be prepared and preventative measures. Nothing. Only thing I've heard is that they're going to fly some people coming out of Wuhan into China or into California, which means they're going to just bring the virus here into a state where there are homeless people sleeping all over the street. And gee, I wonder if it's not a soft form of cleaning up the homeless population and the sick population, because those people aren't going to be able to take cover. But honestly, I also think it's going to backfire because their immune systems are probably stronger after being exposed to poop and rats and plague and disease. They might be the ones to come out on top. You never know. But anyways, it's pretty messed up. Why would they even allow it to come into the country? Whatever. Anyways, it's out of my control. All I can do is report it, I guess. Leung said his team's research showed self-sustaining human-to-human transmission was already happening in all major mainland cities and warned that a pandemic might be close. Sorry, I've got a stuffy nose too. We have to be prepared that this particular epidemic may be about to become a global epidemic. It's already a global epidemic. What the hell? The team's model predicted the number of infections in 5 mainland megacities: Beijing, Shanghai, Guangzhou, Shenzhen, and Chongqing. Hope I'm pronouncing that right. I apologize if I'm not. Would peak between late April and early May. At the height of the epidemic, as many as 150,000 new cases would be confirmed every day in Chongqing, just in one city. Okay, so think about that. Because of its large population coupled with intense travel volume with Wuhan. Now, that nurse the other day that said it was over 90,000 cases in Wuhan said that they estimate that about around 10 people for every one person that exposes people actually catch it. That's just an estimate, of course. So it's probably worse than that. I would think wherever you're going, walking around, coughing, spitting and snotting all over the place, you're leaving it behind for who knows how many different people. Anyways, but Leung added that their projections could be too pessimistic as they only took into account lockdown measures in Wuhan and not other health intervention policies. Leung, who sits on Chief Executive Carrie Lam Cheng Uyghur's advisory committee on the coronavirus, called for drastic measures to curb the spread of the virus. The China bans the wildlife trade in an attempt to halt the coronavirus, which of course that's not the reason for it, but I guess can't hurt to ban the trade either way. Substantial draconian measures limiting population mobility should be taken immediately, he said, calling for the cancellation of mass gatherings along with school closures and work-from-home arrangements. He also said Hong Kong's government's move to deny entry to all residents of Hubei, of which Wuhan is the provincial capital, along with those who had visited the province in the past 14 days, was a good start, which was a reverse from his earlier position where he didn't think it was necessary to close the border because they needed time to spread the virus, But Leung also called on the government to take 1, 2, 3 more steps and broaden the scope of the closure. So the question is not whether or not to do more. Yes, we must do more. The question really is, how can we make sure that it is feasible, implementable, and enforceable. He said, adding the government's task now was to study practical plans such as import arrangements for food and supplies to make further measures possible. Yeah, and exactly, okay, that's just one country that's going to need to figure all this out. What about all the other countries that they just passed it to? Within the next 2 weeks, we're all going to be facing the same disaster. So we're going to help each other at first, and then what? What happens when we all start running out of supplies? I don't know. This is getting kind of scary. I feel like I'm watching The Stand by Stephen King come to life, like a reality version of it. At a joint press conference with Lam and other health officials on Saturday, Leung rejected the idea of a border shutdown. Fool. Saying, for the past 20 years, whether it is avian flu, SARS, or swine flu, we have never closed the border. Meanwhile, the World Health Organization's Director General Tedros Adhanom arrived in Beijing for talks with officials on Monday, but the agency has yet to declare the epidemic a global health emergency. It's a global health emergency. I'm declaring it. China's coronavirus. Hong Kong health minister admits Hubei entry ban is not going to be 100% effective ahead of meeting to discuss the new measures against contagion. Duh. It's not going to be 100% effective because you already let people travel, so it's a little too late for that. Top officials gathering on Monday to discuss new measures against the spread of the deadly virus. Sophia Chan admits that the ban isn't going to do much good. Yeah, but it'll do a little bit of good. Every little bit counts, I suppose. Hong Kong's health minister has admitted the government's entry ban on visitors from Wuhan would not be fully effective as the city's top officials prepared to discuss new measures against the spread of the deadly coronavirus. A steering committee convened by Chief Executive Carrie Lam Cheng-Yuet Ngor decided late on Sunday to bar from entering Hong Kong all Hubei residents and those who had visited the Chinese province within 14 days. The move came into force at midnight with an exemption for city locals. 12 Hubei residents were stopped from getting into the city at a Hong Kong Zhuhai Macau Bridge checkpoint between midnight and 6 a.m. on Monday, a source said. That's so sad. I mean, these people went off for their holidays and now they're trapped. I mean, they can't, in some cases, they probably can't return home. And the hotels and the airlines and whatever, anybody they have to show ID to is going to reject them. So what do you do in a case like that? You're just literally wandering between home and the rest of the world, and you have nowhere to land. I mean, how scary. 12 Hubei residents were stopped from getting into the city. So Hong Kong is denying entry to anyone from Hubei to check the spread of coronavirus. Speaking on, I'm not sure who RTHK is, I guess Reuters Hong Kong maybe, later that morning and wearing a mask, Secretary for Food and Health Sophia Chen-Su-Chi was asked how immigration officials would identify people from the central China province at the center of the outbreak and those who had recently visited. Yeah, good question. All they have to do is lie, which seems to be common around there. The government earlier said those who refused or provided false information when making declarations at the border could be imprisoned for up to 6 months, and fined a maximum of 5,000 Hong Kong dollars, which is equal to 643 US dollars. On whether the local government would consider putting Hong Kong residents who visited Hubei under quarantine, Chan said border control officers would focus their attention on residents at high risk of infection. The Port Health Division would check their temperature, collect their personal details such as their phone number and address, as well as health history, and depending on the situation, whether they need to be quarantined, we need to have comprehensive arrangements. This is a list of the current cases, number of cases total that are actually being reported, although there's a whole bunch that can't be tested, so this is definitely not officially accurate, but 6,154 as of Wednesday morning, January 29th, 2020. Cases in China, around 6,061, so that's the majority of them. The rest of Asia has around 43. 132 people only in China have died, which I find that to be kind of strange. Why is it only in China that they're dying? Maybe it just hasn't progressed enough, because probably going to take about 2 weeks from the time that the first case outside of China popped up that we're really going to see the impact. And America hasn't given its residents any warning, but we've had 8 cases so far, and nobody has told us what to do, how to prepare, how to prevent ourselves from catching anything. They've taken no measures to prevent it from spreading. So, yeah, that's disturbing. Chan added such measures to be discussed on Monday could involve following up on those who had already entered Hong Kong from Hubei before the latest ban was in place. In the meeting on Saturday, we understood that there are different risks and situations, so in the meeting Monday, we will discuss more. Asked if the government had been slow in responding to the contagion, Chan said the administration had to discuss border control measures with mainland authorities before implementation. Screw that. You don't wait. I mean, it's in the air every minute you wait oh man. Hong Kong officials had been working on the details of new measures behind the scenes, even if it seemed not much was happening publicly, the minister added. As the source of the outbreak, the Hubei city of Wuhan confirmed nearly 700 cases of the virus as of Sunday evening, with a total of 1,400 recorded across the province. That was earlier this week, by the way. This is Wednesday now. 8 patients in Hong Kong have been confirmed as having the SARS-like disease, with 3 new cases emerging on Sunday. Chan said it was necessary for the Hong Kong government to implement border control measures given the growing number of infected people. The health chief admitted the government did not have figures for the total supply of face masks in the city, saying it was difficult to estimate. And just for the record, there are actually people in Hong Kong begging us to help them with supplies, so anybody who feels they can help, these people really need it. She only said the government had been in close contact with mask suppliers and new batches would arrive this week. But they said they need disposable clothing, eye protection, facial protection of all kinds, things of that sort, food, probably any basic supplies, I would think. We have spoken to many mask suppliers, but they were unable to provide an exact figure on the total number of masks. Masks are still available in the market, and we've acknowledged that there is a tight supply, said Chan, who wore a mask during the 1-hour program for the first time. She did not wear a mask on another television program on Sunday. even if the mask doesn't prevent you from catching it, it would help to prevent you from spreading it. So I still think that everybody should be wearing masks, even in America and any other country where it's being spread. It's a start. Put on some mask. At least if you're wearing a mask and you're coughing, you're not spitting the virus out all over the place. Maybe wear gloves and try to keep sanitized and keep your clothes washed or disposed of. There's measures we could be taking on our own. So, China coronavirus Premier Li Keqiang orders Wuhan hospitals to admit patients as city struggles to cope. Li visits patients and medical staff and says 2,000 more nurses will be sent in a few days. Mayor Zhao Xianwang says he and local party chief willing to step down to assuage public anger. I guess that means to calm everybody down. Chinese premier has ordered authorities in the city of Wuhan, the epicenter of a deadly coronavirus outbreak, to ensure that all patients with the illness are admitted to hospitals as countries around the world impose travel restrictions and start pulling their citizens out of the city. Li inspected efforts to contain the outbreak in Wuhan on Monday as the death toll rose to 82. So far, all of the fatalities have been in mainland China, where there are also more than 2,800 confirmed cases. It's probably because it mutates. It's probably mutating in mainland China, and that's where the fatalities are coming from. This stupid video keeps getting in the way. Excuse me a minute. The head of the World Health Organization, Tedros Adhanom Ghebreyesus, also arrived in Beijing on Monday to discuss ways to slow the spread. Top Chinese leaders are scrambling to ensure that the preventative measures are adequately implemented to minimize the risk of further expansion, and an outbreak then has already seriously disrupted public life and even politics. You think. Yeah, it's a little bit strange that this this outbreak just happens to occur at the exact same time that they signed the new China trade deal, the phase 1 of it, and we're having a pro-life march at the exact same time that that this virus is killing people, but yet nobody has officially talked to the American citizens about what to do or what's going on or who's responsible, nor have they mentioned anything about the fact that it was created in Canada. So if they stole it out of Canada, why isn't Canada being held responsible? And why weren't we warned on how to prevent anything from happening when it was stolen? Anyways, that's disturbing. So there you go. That's your brief update of the beginning of our apocalypse. I don't know. Our rapture. So say your prayers for these poor people. I mean, look at this. This is like they're barricading themselves in. It almost feels like a burial. It's so heartbreaking. That's a child. Wuhan coronavirus, China will contain demon outbreak. Xi Jinping says as the death toll mounts. He's calling it a demon outbreak. And yes, it is a demon, but it's a pretty interesting choice of words. All right, well, everyone, take your own personal precautions, preventative measures, and try not to go in public, like that nurse said. Try not to go outside. Try not to eat out or go in public. Keep yourself covered and sanitized, and protect your eyes and mouth, nose, ears. I don't know. Try not to touch each other. Don't be all lovey-dovey and touchy-feely. And, I don't know, is it good to go in the hospital and spread it around to other people or risk picking it up, or is it better to stay home and tough it out and call a doctor? I don't know. But be safe.